Welcome to Pain Explained, the channel where we translate complex medical procedures into clear, practical information. If you're dealing with persistent low back pain or sciatica, you've probably heard of something called a lumbar epidural steroid injection, or LESI. But what is it, really? How does it work? And most importantly, is it right for you? If you've ever wondered whether that sharp pain shooting down your leg could be helped without surgery, or whether there's a bridge between medication and the operating room, you're in the right place. Today we're starting a 5-part series all about LESIs, and this first episode is your comprehensive overview. Let's get started. What is it? A lumbar epidural steroid injection is a minimally invasive procedure designed to reduce inflammation and relieve pain in the lower back and legs. It's most commonly used for pain caused by irritation or compression of spinal nerves, like in cases of herniated discs, spinal stenosis, degenerative disc disease, or sciatica. So what actually happens? The injection delivers a combination of a corticosteroid, a powerful anti-inflammatory medication, and a local anesthetic into the epidural space. This space surrounds the spinal cord and nerve roots, and it's often where inflammation builds up and causes pain to radiate down the legs. Who is it for? You might be wondering, is this injection for me? LESIs are typically used for people who have chronic low back pain that radiates into the legs, a pattern we often call radicular pain. It's particularly helpful for herniated or bulging discs that are pressing on nerves, spinal stenosis, which narrows the spinal canal, degenerative disc disease, where the discs lose height resulting in inflammation, and ongoing sciatic nerve pain that hasn't improved with rest, physical therapy, or medications. It's not a first-line treatment, though. Most patients are encouraged to try conservative treatments first, like physical therapy, anti-inflammatory medications, lifestyle modifications, and guided exercise. But if those approaches haven't worked after several weeks or months, your provider might recommend an epidural steroid injection to help calm the inflammation and reduce pain. How the procedure works. The procedure itself is fairly straightforward and usually done in an outpatient setting, meaning you can go home the same day. Here's a step-by-step of what typically happens. You'll lie face down on a procedure table. The skin in the lower back is cleaned and numbed using a local anesthetic. Under fluoroscopy, which is a real-time type of X-ray, the physician guides a thin needle into the epidural space. A small amount of contrast dye is injected first to confirm the correct positioning. Once placement is confirmed, a mix of steroid and anesthetic is slowly injected. The entire process typically takes 15 to 30 minutes, and most people can resume normal activities later that day or the next. Some patients feel immediate relief due to the anesthetic, while for others, the steroid takes a few days to a week to reduce inflammation and ease symptoms. Benefits of lumbar epidural steroid injection. So, what are the real benefits? For many patients, these injections provide substantial relief from pain, often within days, which allows them to resume physical therapy, return to daily activities, and avoid surgery. Relief can last anywhere from a few weeks to several months, depending on the cause and severity of the underlying issue. In some cases, patients might receive a series of injections spaced out over time to help manage flare-ups. However, most pain management specialists limit steroid injections to 3 or 4 times per year to avoid potential side effects. Limitations and realistic expectations. That said, lumbar epidural steroid injection aren't a magic bullet. They don't fix the structural problem, like a bulging disc or narrowing canal, but they can reduce the inflammation that causes pain. Not everyone responds the same way, and some people may not feel much relief at all. That's why injections are often used as part of a comprehensive treatment plan, alongside rehab, core strengthening, posture correction, and lifestyle changes. Think of the injection as a bridge, a way to buy time and reduce pain so you can do the things that actually promote long-term healing. Common misconceptions. Let's clear up a few common misconceptions. Myth 1. It's the same as spinal surgery. Fact. Lumbar epidural steroid injections are non-surgical, done with just a needle, no incisions, no hardware, and no hospital stay. Myth 2. Steroids are dangerous in small doses. Fact. While long-term steroid use does carry risks, these are targeted, localized injections, and the dosing is carefully controlled. Myth 3. Once you get one injection, you'll never need another. Fact. Pain relief is often temporary. Injections are a tool, not a cure. So to recap, lumbar epidural steroid injections are a safe, minimally invasive option for managing lower back and leg pain caused by nerve inflammation. They're not a cure, but for many people, they offer a window of relief that makes recovery and movement possible. In our next video, we'll dig deeper into the science, how exactly these injections reduce inflammation at the cellular level and interrupt the pain signals traveling through your nerves, It's fascinating stuff, and it'll help you better understand how and why these treatments work. Thanks for watching this first part of our lumbar epidural steroid injection series. If you found this video helpful, don't forget to hit like, subscribe, and leave a comment if you have questions. And be sure to check out part 2, where we explore the fascinating mechanism behind how LESIs actually work to calm pain at the source. See you next time.